My name's David Wortley. I'm CEO and founder of 360 and 360 Immersive Experiences and the Vice President of the International Society for Digital Medicine. I'm recording this video as an apology for missing out on presenting at the Gamification Europe 2020 online conference when almost unforgivably I got the time zone wrong, so I was too late to do my presentation. But I hope that this recording will go some way to helping to compensate for that oversight. As I mentioned, I'm a Vice President of the International Society for Digital Medicine, which was founded in China in 2016. I'm going to talk about gamified immersive learning and assessment for preventative healthcare, and how to make gamification for social good, self-financing, or even profitable. The point about my presentation is to discuss the importance of gamification in personal health management. Now, if we look at the causes of mortality in 2020, we can see that, unsurprisingly perhaps, that coronavirus ranks only 14th in global causes of death today. And the top causes of death are non-communicable diseases. And you can see how between 2000 and 2016, it's lifestyle-related diseases that have been the biggest causes of mortality. And you can see how this varies in different demographic areas and in different locations. And in China, in COVID-19 was only the 49th cause of death at the peak of the crisis. And you can see other things, mainly to do with lifestyle-related conditions, are much larger causes of death. And we can see also from a recent study by Statista that it's the elderly that are most at risk from coronavirus, and particularly citizens over 80 and those with chronic conditions. So we live in a world where you're most likely to die from conditions that are related to modern lifestyles. And it's these kinds of conditions that are effectively like a slow motion car crash, as Sir Simon Stevens expressed it, or being rushed towards a cliff edge. And obesity, diabetes, cancer and cardiovascular problems are amongst the largest causes of death today. And these result from lifestyle-related conditions that I'm sure many of you will be familiar with, such as sedentary lifestyle, comfort eating, inadequate exercise, etc. And the fact that we live increasingly in a society where we are spectators of our own destiny rather than being actually active participants in shaping our futures. And this starts at a very early age. So a lot of the advances in technology have not just gone to make life easier for us, but actually to place less of a physical and mental challenge on us. And this is, I think, a bad thing, because these physical and mental challenges are necessary for our lifelong development and health maintenance. And if you combine that with some of the positive advances in medicine that have resulted in us having a longer lifespan, this is compounded by the aging society phenomenon, where as we get older, we are much more at risk of cognitive and physical decline. So there's a whole load of changes that are going on in technology and in science that are creating a situation which is becoming critical and is likely to lead into an unsustainable crisis within the healthcare sector. So how do we address these challenges? Well, there are three solutions that I would like to point to, and I just want to reflect on these very briefly. The first thing is that we can develop clinical solutions that prevent or manage these conditions. And that is what we're investing a lot of time and attention in these days with coronavirus. with a lot of pressure to create a vaccine which will prevent us from catching coronavirus. We can also influence those industries which have an impact on our lifestyle behaviour. And these can take the form of influencing the food industry, for example, or through public policy interventions. And we've got some very good examples these days of public policy interventions with lockdowns and various restrictions placed on our behaviour and our movements designed to protect us from the bad effects of coronavirus. Or finally, we can do something ourselves by developing better personal health management and practices. So these are the three solutions. Clinical solution. Now these are very attractive because they don't require a lot of individual effort from us. We want these types of solutions because if we can take a pill or have a jab, it's less of an effort to be able to do that. We're not so keen on public policy interventions, particularly the ones that we're seeing now with coronavirus, but these are only a tip of a bigger iceberg with lots of other examples of public policy interventions. It's a compulsory guidelines showing us what the nutritional components of food are, taking away cigarette advertising, tobacco advertising in supermarkets, raising the taxes on things that are bad for us. All of these things are public policy interventions. And finally, we can attack these problems through awareness and education. And there's many different forms this take, from serious games, like the lunch crunch example there, building health education into our curriculum, or even including horrible pictures on the back of cigarette packets. And finally, we come to better personal health management. This is what I want to really focus my attention on. And nowadays, we have many technologies, and particularly mobile applications and wearable devices, which are all designed to help us to understand the impact of our lifestyle and be able to monitor and measure things like our weight, our blood pressure, and many other factors. So which is going to be the best solution? Well, gamification, serious games and health. I want to talk about how we can leverage consumer technologies to address these global challenges. My own personal experience is based on being the founding director of the Serious Games Institute, which I took up in 2006 and ran the Serious Games Institute till when I left in 2011. But in 2013, I, for a number of reasons, decided to apply gamification to my own personal health. And this is part of a transition which I think is extremely important generally, that in order to best increase our lifespan, not just our lifespans, the quality of our lifespans, is to adjust our personal behaviours, and to do so at a very early age. But it's not easy. In many cases, we are trying to influence behaviours of people within our family, our peers and our friends. And there are many other distractions which act as barriers. But gamification and wearable technologies, the use of these wearable technologies to monitor your physical activity, your heart rate, and many other things, increasingly are important. And these types of wearable devices range from consumer devices like Fitbit to continuous monitoring devices, which are sufficient medical grade to be equivalent to what you might wear if you were in hospital and you were being monitored in real time. So I want to talk about my own experience as a practitioner of gamification and wearables since 2013. And there's a couple of pictures to show an example of the effectiveness of this combination of an enabling technology like a wearable and a gamification strategy. How I changed my appearance from May 2013 to September 2013, and in that process I lost 21 kilos in weight. I just want to spend a minute or two explaining the circumstances that led me to do this, because in May 2013, I didn't have any health or physical concerns that led me to be forced to change my behaviours and lose weight, but it was a combination of circumstances. And the first of these was when a number of friends came to see me in a stage play. And the picture of May the 2013, that's me on stage in this play. One of my friends came to me afterwards and said, "Dave, where did you get your stomach padding from?" And I wasn't wearing any. Another friend of mine said, "Dave, you're getting fat. I'm getting worried about you." And these only had a little bit of a water off a duck's back, really, because my health, in my opinion, was good. And then I met an academic friend in Covent Garden in London, and she happened to just say to me, "I think you've got some Russian blood in you. Why don't you have a DNA test to find your genetic origins?" So I did this, and I sent off a sample to 23andme.com. And I found that I didn't have any Russian blood in me, but what I did discover was that I'd got a higher risk of getting diabetes 2 than the general population. And this happened at a time when there was an article on the BBC website talking about wearables and how they could make a difference to your lifestyle behavior. So I made a conscious decision to see if I could monitor my physical activity, diet, and other parameters to see what effect that had. And the net result was, over a period of 3 months, I lost 21 kilos. And since that time, I've been an active user of many different types of wearable technologies, looking at and trying to assess the different gamification strategies that these devices manage. I lost my original weight through a device called the Jawbone Up, which is no longer being marketed. But I really liked the dashboard, which showed me the amount of sleep that I had. It showed me my physical activity and how I compared with 10,000 steps a day. And it also rated my food and diet and gave me a food score. And to this day, I still think those 3 parameters are amongst the most important for measuring your health. Other devices I've used include the Buddy Band 2 by Activate Our Lives and the Withings Activate Pop watch, all of which monitor physical activity and sleep. And in the case of Buddy Band 2, it also links into other medical devices that measure your blood pressure and your heart rate, etc. So I can demonstrate from my own personal experience that the use of gamification and wearable technologies can transform me from what I looked like when I was in my early 50s to what I look like in my mid 60s. And I'm proud that I was able to go from the picture on the left to the picture on the right. And not only did this affect my weight and my shape, but it also had an improvement on my not only physical but also mental health. It gave me back a zest for life. So I became a 65-year-old going on 35. And here's another couple of examples of stood by the same person in 2013 before I'd lost my weight to 2015 after losing all of this weight. So I've made this transition from being in danger of many lifestyle related conditions to at least being at less risk of these conditions. And how did I do it, and what lessons can we learn? Well, I want to use an analogy. I want you to imagine for a moment that your body is actually, the analogy or the metaphor is a car. And you can see 2 types of cars here. On the left-hand side, this was an MG car that was owned by my partner. And on the right is my car, which is a little Mini. And you can see how car technology has changed during my lifetime. So I want to use the analogy of life being a journey. and life takes you from the cradle to the grave. And when we make this journey, we have to navigate it, and there are many different waypoints along the way. We know where we've started, and we know what our final destination is going to be. We really don't know what life's journey is going to be like, what it will crop up, what we will see on the journey, how difficult it will be, or how enjoyable it would be. So if you imagine that your body is like a car, and it's your journey, your vehicle on the journey through life, we can look at the way in which cars have evolved before technology. And in the early days, when my uncle was the first person in our street to have a car, he had a Humber Snipe, like the one that you can see on the left-hand side. We used our human skills to get the best from a vehicle, supported by knowledge professionals. So the consequences were that we were very reliant with older cars on garages and mechanics to diagnose problems, to maintain the cars and repair them. But today, we don't need that same level of maintenance and care because of all of the improvements in technology that tell us what the oil pressure are, temperature, speed, range of the petrol tank. They warn us of any impending problems, and they tell us how to get to our destination. So in the period of my lifetime, data measurement and visualization have made a major difference to the way in which we take a journey. And so it is with wearable technologies that provide the same kind of tools to measure our own performance and our own status as the kind of technologies that we see in cars. So what I want to draw the analogy is to say that gamification and enabling technologies allow us to go on a journey, allow us to help navigate a journey from where we currently are to where perhaps we would like to be. And so what are the challenges in using technology to help us make this journey? Well, every one of us has different life circumstances, and these affect our ability to comply with any good health regimes. And in my case, it was easy in a sense in 2013 because I was living on my own. I didn't have to, I could have complete control over my life. I could choose when I ate, what I ate. I could choose when I exercised. As soon as I got involved in a relationship, some 2 or 3 years later, things changed because you do things together when you're in a relationship. You're influenced by your partner's behavior. And so from the time that I started my relationship, over a period of about 18 months, I put much of the weight that I lost back on again. So life circumstances are very important in using gamification and enabling technologies. Also with health, there is a time lag between the cause and effect, both for losing weight and gaining weight. And so sometimes it's very hard to get involved in the disciplines needed to lose weight when you can't see much of a difference from day to day. Health is also a very personal and sensitive subject, and so we like to protect knowledge of our health activities from other people. And unfortunately, we also like things that are not necessarily good for us. And if you look at the corporate sector and the reasons why companies should be involved in trying to gamify the health of their employees, the primary reason is that poor health represents a cost of profitability. If you can improve the health of your employees and get them involved in good health practices through this combination of gamification and health technologies, you're providing a real benefit not only to them as individuals, but also to your organization. You can achieve this by embedding good health practices into a corporate strategy and creating a group psychology within your organization and a shared vision where people want to work together to establish your company, your corporate organization as a leader in health. And finally, gamifying health and health practices can provide your company with competitive advantage. So I want to give a few takeaways about gamification enabling technologies. I want you to think of gamification wherever and whatever it's applied to. It's like a journey. And if you want to be successful in applying gamification, whether it's to yourself or whether it's using as a strategy for other people, customers, employees, etc., you need to try and make the final destination on this journey as attractive, accessible, and affordable as possible. Because if you miss out on any one of those things, attractiveness, accessibility, and affordability, you will find that journey more difficult. You need also to make the journey as enjoyable and rewarding as possible. And if you can, make it fun. And one of the things that I found helps to do this is to create milestones that mark incremental achievement. So in my case, for the last 7 years, I've been walking 5 miles every day. And I use little milestones on my journey as a way of ticking off my achievements. So in my case today, about a third of the way through the journey, I can tick off a particular location and check how long it's taken me to get to that milestone mark. You've also got to be prepared that you will have setbacks. And just like a car journey, you might have diversions and breakdowns, but you need to accept these and prepare for them. And whatever your gamification journey is, you need to make it a learning experience. So in conclusion, looking at gamification and health, influencing lifestyle behaviours is critical to sustainable healthcare. And today you've already heard some great presentations from other people about how you can use gamification to influence health. And wearable technologies which help you to measure where you are on this journey, on this health journey, are great enablers to gamification. And you can apply these to both lifestyle related conditions and conditions like pandemics, where you're trying to influence people's safe behavior. Finally, digital therapeutics, which is the use of serious games, virtual reality, immersive technologies, are an increasingly important alternative to traditional drug treatments. If we can change people's behaviors without getting people to rely on drugs to solve their problems, we can have a really positive impact, not only on global health, but on our own personal situations. So with that, I'm going to stop sharing my screen and say apologies once again for missing out on my slot at the Gamification Europe event, and say thank you to Pete for the opportunity to redeem myself by recording this presentation, and I hope it's useful and enjoyable. Thank you.